Welcome back, everyone. Our next speaker is Dr. Jeffrey Widener. He's currently the founder of QualSci Consulting and provides consulting services for the pharma and biotech industries. Dr. Widener will be talking to you about assay operations, keeping your assays robust and reproducible. Jeff, the floor is yours.
Thanks, Serena. I'm going to follow up to both things that were mentioned in TC and Devin's talks, but with a couple of different changes. Overall, I'm going to start with some introductions. Then I'm going to show you some very real-world data that I've collected at a couple different pharmaceutical companies. And then the main part of the talk is really going to be focused on what we can do as assayers to influence the statistics and the quality of the data that we're giving out to customers, consumers of the data. Okay, this is a slide. I believe the overall diagram at the top there comes from the Assay Guidance Manual, where we outline, basically the processes of putting together an assay. There's the development, and then what we call initial validation or statistical validation, once you've got your parameters set and you're ready to go into production. And then there's operations. So you're actually running your assay. And I've added validation to operations because what I want to talk about that's probably a little different than we've talked about through most of the talks in this workshop is we often use the same assays both for high throughput screening, which is great, but now in the modern age with automation, you can run a high throughput screen in a few days or weeks. Then if you find something, you get into what's called SAR, and you may be running that same assay for years. I have literally run assays that have run over 10 years continuously. How do you keep your assay reproducible across that time? Because people will look at the data in the database and say, wait, last March, that number was X, and now it's Y. You're going to have to change lots of reagents and materials. You may have different researchers come in, to run the assay, over time. So that's where we get into some things about process engineering and design, statistical process control, and I'll talk some more about database reproducibility and MSRs that Devin was talking about in the last talk. So here is a very generic flow scheme for a project. You have your compound collection, you run your high throughput screen, maybe you run some secondaries. And then if you found something, then, they're identified and the structures are characterized, and then the chemists go design more compounds, and you do this loop for months and years and what, on and on and on. And the point here is the reason we're generating all this data is to drive decisions. Okay, I would challenge any of you. I mean, it's okay to run an assay speculatively, but if you're running an assay and nobody knows what the data is going to be used for, you may have better things to do with your time. Or, look into other things that could improve the project or other projects to work on. But you have to keep that data reproducible. And if you're going to run an assay for 10 years, you may very well find you're collecting as much data over that 10 years as you generated in the 10 days or whatever it took you to run the primary screen. This used to be in here just to give people a little chuckle, because it's now the third statistics lecture. But this has kind of gotten a little bit more real in the days of COVID, and we're hearing about different types of tests and positivity, false positives, false negatives, selectivity, and all of that. One of the things that you need to know is that all these terms, especially to a statistician, and I'm not a statistician by training, I just play one in meetings sometimes, is they have very specific meanings. And they're often tied back to the null hypothesis, if you remember your statistics 101. Well, when you're screening, your assumption is you're testing random compounds. So the null hypothesis is what you're testing is inactive. And that relates to a lot of TC's comments and Devin's comments, because they're making statements primarily about the screen. When you're in SAR, however, I tend to flip the null hypothesis, because now you're starting with a known structure that you know somehow interacts with your molecular target of interest. Or if it's a phenotypic assay, shows up, as affecting your phenotype. Then so then you have to assume that most of your compounds will be active. And that also tends to flip some of the statistics on its head a little bit, because the cost of a false negative is even greater than it is in a high throughput screen, because you may find, if you're running a high throughput screen and you find 1,000 actives and 500 of them confer, you're great. You've got more chemical matter than your chemist will be able to make use of, probably. If you're running an SAR and in a particular series they're running 10 compounds, and you miss 2 of them that you say were inactive that should have been active, they now have bad information, and that may affect the ability to develop a clinical candidate. So this is to just get back to this accuracy and precision. I'm sure everybody's seen diagrams like this, but essentially, precision has to do more with random error, so how tightly your data points are spaced, and accuracy is systematic error, so how far are you away from the true value? Now, the challenge is, particularly for research, you don't know what that true value is. You may eventually get to it, particularly if you have a compound that you've tested many, many times. But even in an in vitro test, it's unlikely that your conditions will precisely mimic what goes on in vivo. And we can talk about accuracy, precision, consistency, robustness, all of these things. I've just shown you here kind of 3 different scenarios. So in each column, you can think of each column as a different experiment. So this was the one I ran, 4 weeks ago, and 3 weeks ago, and 2 weeks ago, and this week. So if you're consistent, precise, and robust, it doesn't matter. It's likely that something changed, whether or not you knew what it was, but even the temperature in the lab, or the time of day that you ran it, whatnot. But that's the ideal. Consistent and precise. That's not too bad. As I said, we're talking primarily about in vitro assays. We know in vitro assays are not necessarily going, as much as we try, they're not necessarily going to mimic the real disease state, what happens in a patient or an animal. But precise without being consistent, that's a problem, here. And obviously there's other permutations that you can have, throughout these different concepts. Now, one of the things I want to bring up here, and I know this slide gets shown a lot, is this whole concept of reproducibility. And if you read this paper, it's basically a great review paper. One, it highlights, and this is just in terms of NIH spending, I believe, this number, but it highlights kind of categories of errors that they have seen, whether it's just documenting your protocols, errors in how you do the data analysis and reporting, or the study design, reagents or materials that aren't quite what you think they are. Those are the kind of the common things. They're all things that we can address as laboratory scientists. Another thing we have to think about is the cost of quality. It's great to think that, in an ideal world, we have unlimited resources and quality at any cost. But just kind of generically, there is this kind of curve that we can see, where, you can put a little bit more effort into what you're doing, maybe spend some more money, run some replicates, buy a better quality reagent or a more trained person or better automation, and that will improve things. And eventually you can get your quality all the way down, but there is a cost component that goes with that. So what we want to do is we want to kind of find the sweet spot in this equation, because everybody's got a budget, whether it's your R01 grant or your project's budget, at a large pharma company. There is only so much money to go around. And I would submit, now these numbers are just approximations of what I've seen over my years in the industry, but one of the sweet spots here is our in vitro assays. Because if I'm running a biochemical assay, even in a 96 well plate, I can probably run that for a buck a well or less, and I can run as many of them, thousands and thousands, as you want. Some cell-based assays may get more expensive, particularly if you're doing something, like high content assays, other things like that. So maybe they're $10, but you still have lots of capacity. If you have never worked with animal models before, it's hard to run an animal model, an iteration of an experiment for an animal model, for less than $10,000, and it can go way higher than that. So by spending a little bit more money here, maybe by, to bring down the MSRs, maybe get those replicates, make sure the numbers are right, you may actually end up saving money and making your project more efficient, because you're not putting into those downstream experiments that are more expensive, compounds that are, shall we say, dubious in nature at best. Okay, so that's the kind of background stuff. So this is just a transitional slide, but Edward Demings has a quote. He's one of the kind of fathers of statistical process design. Without the data, you're just another person with an opinion. Okay, so I want to show you some real data, real world data from a large pharma company that kind of illustrates what we're talking about. So here what we're seeing is, I took a snapshot of all the assays all the in vitro assays that were running at the company over the course of a year, that had more than 100 samples tested in replicate. And I looked at the database MSRs for all of those assays. So this is just a histogram of that. And as Devin was talking about, the database ones are going to be where you capture all the sources of variability. And what you can see here is that half of the assays basically are running with an MSR of 3.7 or less. Okay, so some of them are, as he was pointing out, a lot of, especially in the biochemical assay world, you can have assays running, MSRs of 2, 1.8. They look pretty good. And, I would say kind of the, 5 isn't necessarily that bad. Again, you can throw in another replicate or so, and we'll talk about that a little later, to kind of drive that number down. But even out here, where it's 10 or 20, if you're running a selectivity assay and your criteria is maybe 1,000-fold selection between your primary target and an off target, or a related target that you don't want to hit, there's nothing wrong with 10, but you don't, or 20 even, but you don't know that. All assays are hypotheses until you actually start to run them and see how they perform in the real world. And sometimes, I wish Terry was online, for those of you who saw his talk on cell assays yesterday, sometimes you can use this to mine out useful information. So this is that same date from that same data that I showed you, and of those 300 and some odd assays, basically half of them were 144 of them were biochemical assays, and the other ones were cell-based assays. And we're talking about a large pharma company, so we're pretty much looking across the range of binding assays, enzyme assays, you know, all the different modalities for looking at kinases, let's say, within this. Within the cell assays, you're looking at functional assays like calcium flux, cyclic AMP, proliferation, cytotoxicity, cell shape, whatever. You can see here it is possible, and in fact, at this company, the reproducibility was virtually the same for the biochemical assays as the cell assays. Now, these were all well-validated assays, but don't let people tell you that cell assays are by nature less reproducible. It is harder to get them to be as reproducible, but it's certainly achievable. Now, this data takes a little bit of explanation, but this is basically SAR data. So that's the structure-activity relationship. Chemists are making compounds for a purpose. And what I did was I looked at the data that came from assays run within 6 months of the synthesis, and the initial synthesis of a compound. So that said, it wasn't in widespread screening. It hadn't had a chance to get into those libraries yet. So primarily, within 6 months, it's probably just seeing the assays from the project that it's in. And within any one assay, how many times was that compound tested? And in this case, it was basically 85% of the time, it was N of 1. And only about another 10% of the time did they get a single replicate to make N of 2. And sometimes they'd do an N of 3. And then it was the extremely rare compound that got, N more than 3. Okay. And, observationally in working at a couple different large pharma companies, as well as talking with people at meetings or whatever, the numbers may vary slightly, but this is not that unusual. So this is probably the statistically most geeky slide I've got. But as TC noted, he's talking about 95% confidence intervals and 2 standard deviations and 3 standard deviations. That's great when you have N's above 30. When we typically don't get that luxury, but there is an area of statistics called where you deal with small sample statistics, and you can look up this table online or in your undergraduate statistics book. In the appendix in the back, they'll have tables that look like this. And basically what the table is showing is this is basically a student's t-test, if you remember what those are. And because statisticians count things in degrees of freedom, when they talk about one side, 2 sided, and you see these numbers there, 1 degree of freedom means you have to have 2 measurements. By definition, you cannot measure the variability of something by only measuring it once. You have to measure it at least twice. Well, if you've only measured something twice, you want to talk about a 95% confidence interval, that's almost 13 standard deviations. It's not 2, so if you go up just 1 to an N of 3, now that drops to 4. And by the time you get to an N of 5, that drops to 2.5. So very quickly, your data can get tighter just by running replicates. And that's something we will come back to throughout this talk. And again, here's some real world data. This is from an assay that ran in my group for several years. The MSR on this assay was basically 4.6. We didn't think that was good enough for what we wanted to use the data for. But if we just look at the data here for that MSR, what we can see is basically if the MSR is 4.6, 95% of the observations fall within a 4.3, or excuse me, MSR is 4.3, not 4.6. The 4.6 comes from basically this number, and the 0.3 comes from this number. And so in between that's your 95% confidence interval. So 95% of the observations fall within that 4.3, but 80% of them are only off by a factor of 2 when we actually measure the replicates. Okay, that's the statistical distribution. So when you measure an MSR, you need to keep that in mind. Most of the data is actually better than the MSR will tell you it is. But if if you actually have the replicates, what you want to do, well, here, this is an illustration from the database MSR. This is called a waterfall plot, but basically each row, all the dots are the same compound and in individual measurements. Okay, and here's the log potency here. And you can see many of them are close. Things that have been measured a lot of times, these might be control compounds or whatever. You can see you get a range of measurements, that something happened on some day or in a certain well. This was over the course of a year of running this assay. So if we look at that one assay with an MSR of 4.3, and we just look at the range of the data between the maximum observed value and the minimum observed value, we see the median range was about twofold, and that fits in with what I was telling you about 80% of the data comes within twofold. But look at this point here that I've got circled. In this inset here, what I'm plotting is the range between the largest and the smallest value and the number of times the compound had been tested. So watch this circle in the next slide. This is an illustration of the value of getting replicates. That's the same compound, but now we're looking at the 95% confidence interval, and you've gone from being kind of up here, near the top of the range to lowering that very, very dramatically. So even just getting replicates on everything, when maybe not when you're high throughput screening and you've got thousands of doses to go through, but when you're getting 25, 50, even 250 compounds a week, it's very achievable. Okay. Now what can you guys do? And John Wooden, if you're not a sports fan, is a famous basketball coach, and he says it isn't what you do, but how you do it. So I'm going to talk about statistical process control, and we're going to talk about 3 things that you can do to keep your to look at reproducibility, and that's measurement system analysis, which you haven't heard about yet, control charts, and the test-retest experiment. First principle of statistical process control: don't change anything. It's likely the way we set these confidence limits, as Devin was saying, they're usually 3 standard deviations. It's likely this 1 in 100 random error. And if you change something, just because you see an error in a control chart, you're likely to make things worse. Second is find the root cause before you implement any changes. So you need to investigate if that error reproduces. Then you correct the problem. You can use the test-retest study to validate any changes, and then you can go back to keeping your customers happy. MSA, I'm going to go through this real quick because I got a late start, but it is a form of ANOVA. So it basically breaks down all the variability that you can observe in an assay into what is the truly random variability. And then, and this is kind of the speak of statistical process analysis, we talk about the measurement system, which is the part, the operator, and the gauge. And I'll explain what those are on the next slide. in terms you'll understand, but you can look at the linearity and the variability and the bias and the reproducibility for any of these components. MSA is something, and any ANOVA, you really need a statistician for, or some Six Sigma black belts and engineers have been trained in this and have used it enough to be able to do it. But it's not something that you should do unless you really know what you're doing without a consultant to back you up. So let's look at liquid handling, one of the most common things we do in assays. So in the case of liquid handling, what's called a part here, you might have different, let's say, liquid types. You've got an aqueous solution, you got DMSO, 70% ethanol, maybe you got a really viscous reagent. Those are your methods that live in your liquid handler, and you say, okay, I'm doing this, so I'm going to run method X because I'm pipetting aqueous. Operator is kind of who's running it, and gauge is really, think of as the ruler or the instrument that's performing the task. So if your ruler isn't calibrated properly, you're not going to get a good measurement. Liquid handling. So we have to measure. There's a lot of ways we can qualify liquid handling. Gravimetric is absolutely unsuitable for these tasks because you just get a plate average. So we have to use some optical method because we want to be able to measure what's going on in every individual well. And it's kind of which came first, the chicken or the egg. If you're going to be using an optical reader to do your volume analysis, you first have to qualify your optical reader. And that means doing simple experiments that many of you may have learned, like this one, where you can see a pattern in this data. If we rotate the plate and reread it, flipped 180 degrees, if the pattern moves with the plate, then that's a liquid handling problem. If the pattern stays with the detector, then you need to service your detector to get rid of the pattern, and then you can move on from there. And ideally, you do this with a 2-dye ratiometric system. There are commercial solutions available out here. Artel is one of the big names here. And I've just put out a link here to a document on their page that talks about liquid handling more than most of you want to know, unless you're an automation engineer. But when you do these analyses, what you can see, and this is an example that I pulled up, I'm not going to talk about this top left figure, but we can see the chart by operator. Okay, so we can see, and we had 2 instruments. So we had 3 operators, or 4 operators and 2 instruments here. And we can see, instrument 1 is fairly consistent, okay, and consistent across operators, but instrument 2 tends to be a little bit higher with everybody, but instrument 2 is higher really with this person here, Tech 3. And we also see here, as we look at just the instruments, instrument 2 is higher and has more spread in the data. And we can see the differences between the technicians here. And what you see here is that if basically we can look at interactions between these different variables. So if you have non-parallel lines, that means there's an interaction. So what might be going on in this case is instrument 1 is a well-validated instrument that you've had in the lab for a long time. Instrument 2 is a new instrument. Most of the people have been brought up to speed on it, but it's maybe not quite calibrated to match instrument 1. And maybe technician 3 doesn't have as much experience on that. The reason that I've used liquid handling as an example is an SAR, you're usually working in dose response mode. So errors will tend to propagate. And I don't have time to go through all of this, but you get a huge range of values by the time you've done 10 or 20 dilution points on what the concentration is at your most dilute point. And that will impact your IC50s, obviously. Control charts, they're a very commonly used tool. They're the easiest one to do, and you can put together the kind of control charts you need in Excel pretty simply. They use 2 time-based graphs, so you're going to be measuring things over time. This could be if you're screening, you might measure every plate, across a, 18-hour run, to see if anything changed in your controls from the start of the run to the end of the run. Or it might be you're measuring it every week, week to week as you're running SAR. So you plot whatever parameter it is you're measuring. So it could be, let's say, the IC50, as Devin was talking about in the MSR control charts. It might be the raw value of your controls, or whatever else it is that you choose to plot. There are many things you can do, but they're pretty easy to do. And then you also plot the variability in that number on a second graph, because you want to make sure not only is the accuracy there, but the precision is there, which is why we look at both the measured parameter and the variability in that parameter. Most of what we deal with is continuous data, so that makes it really easy. And all you have to be aware of is how much data you have. So if you're only getting one measurement, you have to do like Devin was illustrating with the MSR control chart. You plot X, and then you use something like a moving range, or in this case, we were calculating the MSR over the previous 6 weeks to get that variability chart. If you're looking at, say, the control values or the Z primes on every plate, you would plot the average within that experiment. And if you're only doing, a few plates, let's say 6 to 10, or less than 10, you plot the range of those values. If you're doing a lot of plates, you plot the average and the standard deviation. There are other types of control charts, but they're for categorical data, and we don't tend to use those a lot in research and primary research laboratories doing in vitro assays. Here we want to look, I just do this real quickly. We're looking at basically how Z prime changes by the number of control wells you have for each condition. So I just took a sample of 10,000 max and min controls that I just calculated randomly for different assays with different Z primes. And if you only use 4 wells, let's say you're a 96 well plate and you only want 4 wells of each so you can screen more compounds, this box plot shows you the distribution you can get across 10,000 or 1,000 plates rather of running that. And then as we go across, you can see the data gets tighter as we increase the number of controls. So again, it's back to that, t-test distribution chart that I was showing you. If you're only running a few controls, let's say 8 here, and your Z primes are low, you might call, even though your true Z prime is 0.6, you might need to call a 0.4 as in control. It's not, you don't throw out that plate. But a 0.4, if your normal Z prime was 0.8, yeah, you would be way out of control. Okay, this is just an example of what those X-bar R charts and SD charts looks like. As I said, you can build them in Excel. Devin pointed out, we've got one on the AGM that you can get through the AGM in the assay validation chapter, I believe, that has the MSR control chart, or assay operations for SAR support chapter. Okay, Bland-Altman difference plots. I've only got a couple minutes here. These are basically the test-retest study. And all you're doing is you're measuring 2 sets of conditions, and this is well documented in the statistical literature for the biomedical field going back, now almost 40 years. And you look at the average of those measurements that you plot on the x-axis and the difference between those measurements on the y-axis. Now, the reason that that's important is that besides doing an initial validation, as Devin talked about, that lets you validate changes. So let's say you bring in a new assayer. So measurement 1 might be assayer 1 and measurement 2 might be assay error 2, or you're changing a lot of reagent. So you have your old lot and your new lot. And this is much simpler to do than the MSR or the measurement system analysis, the MSA. So Devin talked about that. These things can be set up in Excel, and we have that available to you guys. And if you know you're going to be making a change, test it out before you implement it into production. That keeps the phone calls and emails down to a minimum. Again, we're looking at cost efficiency. What might surprise you is that you know the exact same assays. This is an analysis I did for another client. Basically, same assay. We had about 50 different assays where we broke down the costs here. In SAR, most of your cost comes from labor and some from supplies and materials, a little bit from equipment. It's flipped between the labor and supplies and materials for screening. How is that? You know, because you may use a lot more, you will use a lot more in a high throughput screen. Well, if you think about it, it's pretty self-obvious. It does not take you 10 times as long to make a liter of buffer as it does to make 50 mils. So your labor costs tend to be fairly fixed. So why not use that fixed labor cost, pay for a little bit more reagents and get some cheap screening? I'm going to skip that. You can also look at how we do things. So here is a comparison of two different ways that we could look at building dilution schemes. 10-point dilutions are fairly standard. We in the industry have been for years. And it's really dealing with 3 points that have the majority of the information. You also only have a 20,000-fold dynamic range here. It's been a workhorse, but could we do better if we change things up a little bit? Well, as plate densities have increased, it's now very feasible to do a 20-point 2-fold dilution. Now we've basically enhanced our dynamic range by, more than 20-fold, which means you can measure, a broader dynamic range of potencies without having to change your assay conditions, your dilution schemes. So you get fewer less than or greater than values if you're doing this. You now have 7 data points, here on the slope of the curve. And the chance that all 7 are going to be displaced in one direction or another, if the error is truly random, are really pretty small, where it's only 1 in 4 if you're doing a 10-point curve. So does that work? Yes, this is simulation data, but I validated this at 2 large pharma companies where I've worked. And what you can see here, what we're trying to show here is that assays different Z primes. And we looked at different types of curves. So was it focusing the center of the curve or the edge of the curve? We looked at 20.2-fold, 10.3-fold, and 10.4-fold between the dilutions. More data always wins in terms of giving you the best MSR. And by the time you get to 20 points, even if you have a fairly poor Z prime of 0.1, you can still get a respectable MSR. So that's something to keep. And as I said, I can't show you the real world data because I never got clearance to share that, but I validated that at 2 different large pharma companies in experimental side-by-side comparisons. We're coming to the end of the time, so I'm not going to go through this very much. I'm going to skip this slide. I want to highlight there's also a new chapters just appeared in the last few months in the assay guidance manual about communicating and reporting data, and I would encourage everybody to go and take a look at that chapter. I've referenced it here. It will give you ideas about what you can do to make your communication with your colleagues, because you know what you did if you're the guy who ran the assay, and you could probably look at the raw numbers that come off the counter. and have an idea whether it worked or not, whatnot. If you're not in that room, or if you're going back 2 years later, or even 2 weeks later, sometimes it's hard to keep track of this stuff. So how we communicate and report the data is another way that you can improve your reproducibility. And with that, I think I'm at the end of my time. I am going to sign in for Devin's roundtable session on data analysis. So if people have questions, I would be happy to elaborate on anything that I've had to kind of very quickly march through here, given our technical difficulties at the beginning.
Thank you very much, Jeff. Actually, there's 2 questions for you, and we do have a minute, so maybe we'll address one of them. So the question is, do you think that the irreproducibility are based on mislabeling of compounds or impurity? And then it follows by, how can we improve the public databases in terms of biological and chemical structure to increase reproducibility?
So I think in terms of what's the primary cause of, the errors in the data, that's always hard to do. Everybody likes to point fingers, but what I will tell you is, in 30 years of doing this work at large pharma companies, a good quality sample is likely to be 95% pure. We're not dealing with API grade samples. And if you look at this in the range of potencies we can get in things, it's almost impossible for me to tell you as the biologist whether or not that potency is driven by a 1% contaminant or the 95% good stuff. And that's why we, look at multiple lots, multiple ways of synthesizing it. And the further you go along the process, the higher the requirements come for what you're doing. But there also will be things that, I've had changing the lot of a plate. When a manufacturer changes the process, throw my assays off. We tend to think of things like plates and tips and that as being pretty standard, but you don't know. And I know of stories where, because the sun was coming in through a window in the lab based on the time of year, assay plates would be a different temperature than in the summer than the winter or what. So this is why you need to keep track of all of this. And the control charting makes it very easy to spot those things quickly. So you don't have to do ideally you would do like the big measurement system analysis either at the beginning, or that might be something that if you're in a big lab, your automation engineers take care of for you, and they say, okay, we qualified this this program to do this type of liquid, and we know that it works because we're keeping that control chart every week, and we do our preventive maintenance, and we recalibrate it whenever we need to. So if you're just keeping track then of your, let's say, control values or your potencies, then you can go to the liquid handling control charts and say, that's the problem.
Thank you very much, Jeff, for that elaborate answer. Oh, sorry.
Talk to some of you at lunch.
Yeah, you do have, may have more questions, so keep an eye on the chat box. And anyone that had questions for Dr. Widener that we couldn't address, again, we have spots in the roundtable run by Devin. So please go ahead and join that roundtable, data analysis roundtable, by sending a message to Abigail in the chat. Okay.
And Serene, I'm sorry to interrupt you here for one more moment. Jeff, we do have Terry Riss as an attendee. He's not logged in as a panelist, but he could give you an assist in the chat if you want him to weigh in on anything. Just type it on into the chat box. Thank you.
Okay.
Wonderful. Thank you, Abigail.